Let me turn now to Dr. Budoff to sort of give us a recap of the REDUCE-IT trial. You mentioned it, but to talk a little bit about the inclusion and exclusion criteria, what the main results were of the overall trial, and even to comment on the US results. And I think that's particularly appropriate since Dr. Budoff was one of our leading US investigators in that study. So Dr. Budoff.
Yeah, thank you, Deepak, and certainly this was led by you, so certainly please correct me as I go through this, but a very important and very large trial, taking patients with both primary prevention, those with diabetes and cardiovascular risk factors, as well as secondary prevention, those with established cardiovascular disease, and randomizing them to 4 grams of icosapent ethyl or matching placebo. We enrolled over 8,000 patients, and at 4.9-year follow-up resulted in a robust event reduction. There was a 25% reduction in the primary endpoint. And importantly, as you mentioned, the US cohort, which was over 3,000 of those participants, the event rates were even greater. There was a 31% event reduction in that cohort, including all-cause mortality. So I think that as we think about the implications of the REDUCE-IT trial on top of statin therapy, on top of good background therapy, by taking patients with triglycerides between 135 milligrams per deciliter up to 499, so elevated triglycerides, we literally reduced events, I would say, more robustly than we've seen with other add-on therapies. When we think about IMPROVE-IT or Fourier or Odyssey, these other LDL lowering algorithms, we lowered events by 6%, 15%, maybe even 20%. Here we saw a 25 to 30% event reduction on top of a statin therapy. So I think we saw a robust event reduction. And no matter how you looked at the data, really, the primary prevention cohort, the secondary prevention cohort, men, women, age, triglyceride cut points, it was a very uniform benefit by being on icosapent ethyl for this population.
Yeah, I think that's a nice summary with, as you mentioned, the relative risk reductions for the primary endpoint were large, 25%. And for total ischemic events, again, depending on how that's defined, not just the first, but recurrent events anywhere, on a 30, 32% relative risk reduction there with large absolute risk reductions. What do you think, and this is perhaps a little bit speculative, are the mechanisms of action behind icosapent ethyl and its reducing cardiovascular risk?
Yeah, so I think we're still exploring that more. It's clearly not just triglyceride lowering. Triglyceride lowering is actually fairly modest in these trials, and we've seen that from another trial with a similar molecule in the GELIS trial, where we saw larger event reductions than triglyceride reduction. So I do think it's multifactorial. But it does appear to have some mild antiplatelet therapy. We've seen, very, very mild, but notable increase in bleeding risk. We have to, very, very minimal, but I think that does show that it does have an antiplatelet activity that might be beneficial here as well. And I think that overall, we just saw a very nice total event reduction. So I think it's probably triglycerides. We know it has some effect on oxidation. Dr. Mason, Preston Mason out of Harvard has shown some really nice biological effects on plaque stabilization and how it might affect the lipid bilayer and really prevent destabilization. So I think that there's a lot of potential effects here that are clearly beneficial, but the uniform benefit that we've seen in every subgroup really reassures me that this is a robust adjunct to statins for our patients and long-term prevention.